Hi, welcome to Pathology Riddles. Today I lost a table tennis match and I would like to share with all my viewers towards the end. Please bear with me so that I can make my heart feel a little lighter. So let's go right into the topic. The topic is cell injury. This is for the benefit of second year MBBS students who have just joined their classes and all those who are interested in pathology. Normally, our cell maintains a narrow range of structure and function. And when it maintains this, it is called as the cell is in homeostasis. The cell is stable or in equilibrium. But whenever it undergoes some kind of stress or some injurious agent is nearby, what happens? It can either undergo cell adaptations. It will undergo some changes in its structure, changes in its number, changes in its function, changes in its phenotype. These are called as adaptations. And whenever the stress goes off, the cell can go back to its normal function and structure. We'll learn more about this in the next video. But sometimes the cell is not able to adapt. At that time, it undergoes reversible injury. Reversible injury means there are some changes in structure or function. But after reversible injury, when the stress goes off, the cell can go back to its normal structure and function. But if the injurious stimuli is there for long duration or it is there in severe amounts, then it will lead to irreversible injury, which will lead to cell death. Cell death are of two types. The first one is apoptosis, the other one is necrosis. In simple words, the difference between apoptosis and necrosis is, in necrosis, the cell membrane is broken and the enzymes leak out and finally digest the cells. The enzymes come from the lysosomes of the cell or from some WBCs. While in apoptosis, whenever the stimulus is stopped, like the hormonal stimulus, then the cell will undergo a program called as programmed cell death. Apoptosis is a programmed cell death. It's just like computer programming, where when the signal is not there, it will not work. So apoptosis is a clean type of death, where the cell membrane is not broken. But there are certain enzymes within the cell which are activated in order to kill the cell very cleanly. These are called as caspases. So basically we know that the cell is in homeostasis, and if it undergoes stress, it will try to adapt. If it cannot adapt, it will undergo reversible injury. If that stimulus goes off, reversible injury will go back to normal. And if that stimulus is there for a long period of time, or if it is in large amounts, the cell will undergo irreversible injury and will finally undergo cell death. But what are the kind of stress that the cell can undergo? They could be of various types. I'll give you a simple mnemonic so that you can remember. It is called A, nut, hit, pig. A, nut, hit, pig. I'm also an animal lover. There's nothing against the animal. It's just to remember, because mnemonics helps you remember easily. So A stands for aging. So one of the stress a cell faces is aging. NUT, nut, stands for nutritional disorders. It could be due to overeating or due to reduced eating. H is hypoxia and ischemia. They go hand in hand. When the blood supply reduces, the oxygen supply also reduces to the cell and it undergoes some changes. I stands for infectious agents. It could be various infectious agents, from bacteria to virus to parasites and so on. T stands for toxins. Toxins could be insecticides, or it could be some kind of drugs, or there could be some venom. And these are the various types of chemicals. They come under toxins. So we finished a nut hit. Then we go to PIG. What is P? P is physical agents. It could be heat. It could be cold. It could be pressure changes. I. Again we have one more I. I stands for immunological disorders, which could be some type of allergy or autoimmune disorders. And G stands for genetics. Genetics are, for example, Down syndrome or sickle cell anemia. So I repeat, A stands for aging, NUT stands for nutritional disorders, H stands for hypoxia and ischemia, I stands for infectious agents, T stands for toxins, P stands for physical agents, I stands for immunological disorders, and G stands for genetics. These are the various categories under which the injurious agents fall under. I hope you can remember it later. And now coming to our table tennis match. Imagine for a moment that you and I have reached the final tournament of table tennis. And I have reached the final tournament for the first time while you are an experienced player. I go to the first game. And in the first game, I learn that your tactics or your techniques have changed and you have emerged more powerful. So I, as a player, I am in stress. I try to adapt, but I fail the first game. But then I still have chance to recover. I play the second game, but I was not able to adapt. I couldn't change the game. It became an irreversible game. I lost the match. So basically, I was trying to explain this concept to you. So I was playing against you. At that time, imagine that I am a cell. You changed your technique, so I am in stress. I tried to adapt to your technique, but I failed the first set, so I underwent reversible injury because I can still play the second set and come back and stand a chance to win. But I was not able to reverse it, and I lost the second set, so I underwent irreversible injury, and I could no longer have a chance to win, and that's why I failed. I lost the match. I hope the concept is clear. Do subscribe if you want more videos like this, and share it with your friends so that people can benefit if they have difficulty in learning pathology. This is Dr. Susan signing out until we meet in the next video.